All right. Hello, everybody. My name is Christopher Briggs. I'm the Publications and Public Affairs Counsel for the Independent Institute based here in Oakland, California. Thanks to Obamacare's canceling twice in a 3-year period our health care for my daughter battling cancer, I was asked to testify back a few weeks ago in front of the U.S. Senate about the harm Obamacare is inflicting on America's families and what to do about it. I was, of course, quite pleased that my testimony went viral. Um, Particularly my opening remark where I turned to the senators and asked them, if Obamacare is such a great healthcare plan and no harm has really come to anybody because of it, then why aren't all of you on it? And what I got is what I expected, which was deafening silence. They inflicted this plan on all of us, but have exempted themselves from it. The other thing I've noticed in these years since I've been battling Obamacare and trying to save my family from it is that the Republicans have been very good about voicing their opposition to Obamacare, but not many have been given really concrete solutions on how to repeal it and then give us something better. So today I'm beginning my quest on my own for that. Who can show us real effective legislative change that will take the U.S. government out of the business of inflicting medical serfdom on the American people, and particularly on American families. And my first guest today is Michael Cannon of the Cato Institute. Welcome, everybody. Particularly welcome to Michael Cannon, who was the director of health policy studies at the Cato Institution. I'm Christopher Briggs, and I'm the Publication and Public Affairs Counsel at the Independent Institute. And I really wanted to have you on, Michael, because the two of us recently have had some interesting interactions with the public regarding our healthcare experiences. As you know, from a mutual friend, I was able to testify in front of the House in 2022, and then the Senate last month, as the healthcare debate was kind of running through the country, in front of the Senate, and the clips of that went viral, and we had a couple million views, combining YouTube and social media. And then you had the extraordinary experience of having written a very interesting paper, which I want to get into in detail if we can, about how to fix the problem with Obamacare and give us more healthcare choice and better healthcare as a result. And that was, you got yourself out on the news media, and then President Trump noticed this and then did the extraordinary thing of tweeting it out and said people should pay attention to this. So I just wanted to make sure that we had a chance to talk. You and I have been friends for a while. We met through a mutual acquaintance back in 2017 when my situation, again, I had a daughter with cancer who lost coverage under Obamacare twice in a 3-year period. When that first episode happened in 2017, you and I were put in touch with each other. And, I'll never forget it when we were first on the phone, you said, Christopher, your problem's way worse than you realize. I mean, not only do you have a really sick daughter with cancer and you've just lost your coverage, but actually, if we ever, get rid of Obamacare, you're gonna have a problem because she has a permanent pre-existing condition because she got sick under a non-insurance regime. That caught my attention, and you've been giving us guidance as a family ever since. So
I think I put it a little more delicately than that.
okay,
And don't sell yourself short here, because yes, you've testified before the House. Yes, you've testified before the Senate. The Congress, the clips from that went viral. And yes, President Trump posted a quote from me that was broadly faithful to things that I said. I don't think any of that compares to the coverage that your story got in 2017 in the Washington Post and at NPR and other places about what Obamacare was doing to your daughter's access to the cancer care that she needed. That was really high profile stuff. That might have been how you came to my attention in the first place. And it is really emblematic of what I think is the biggest problem in Obamacare, which is what it does to the quality of health insurance.
yeah, no, that's exactly right. And my case, you and I just have discussed this. In some ways, I'm unique because I managed to have this really bad problem with a very sick child under Obamacare. But there's some stuff that has actually come to everybody under Obamacare. And so let me just jump into that. I want people to understand some of the flaws of Obamacare. You can explain why they happened, and then I want to get into your solution because I think
And it's important to keep in mind,
Yeah.
that's not what makes you unique. There are
Yeah.
other people who are suffering what your family has suffered. What makes you unique is that you are a public policy PR guy who knew how to work this system to bring attention to this problem and who has principles, including this strange belief that people should be able to make their own healthcare and health insurance decisions, that has driven you to work for independent and to push back on what Obamacare has done to access to care for millions of people.
Now, you bring up a really good point. Just for me to take 10 seconds on this. So when I was in the middle of when I first discovered in 2017 we weren't going to have coverage in 2018, um, I managed to get the Washington Post to cover our story, did a bunch of PR because I'm in this business and I knew how to do this. And it really struck me like this was, not the way a marketplace is supposed to work. I mean, if guys like me with a lot of fancy education, I'm in this field anyway. Certainly I'm going to be able to make a story out of it. What about the cancer patient and his parents or her parents next to me in the clinic? If I didn't do this, they would have no way of doing it. And so we never judge the health of a market by how the guys at the center, we're kind of at the center, are taken care of. We'll kind of manage on our own. It was bad for me, but it was way worse for those who had no voice. And I think this is kind of really important. Is that what is it? It's called an Obamacare marketplace, but it's not a marketplace. Not really.
Right,
So
and you were
anyway,
able to overcome
yeah,
the problems that Obamacare created
right.
for you and your family by knowing how to work the system, to get the Washington Post to cover your story, to get NPR to cover your story, by haranguing your senator until your senator did something. But you're right, the person next to you in the clinic, they don't know how to do that. And so, and there are more of them than there are Chris Briggs. So we
A
should
lot
get
more.
into your story
Yeah.
because this is the really
Right.
compelling part of.
Right. So my story starts in 2004 when I stepped out of my corporate job and decided to set up my own consulting company. I looked around. Obviously, we have a family, and I wanted to provide healthcare for my kids and my wife. And I found that in the pre-ACA marketplace, Michael, you've spoken about this, and I lived it. There was just a lot of choices for us. There's a lot. In fact, so many we had to get an insurance, a broker. These guys don't exist anymore, really, but they did then to explain everything. We found a plan that we liked, and we had it for years. Under Obamacare, we weren't able to take our sick daughter to Johns Hopkins, but before ACA kicked in and before we had cancer, her older siblings had gone to Johns Hopkins, which is up the river from us here in Northern Virginia, any number of different times. So we had actually really good access, and it was actually quite affordable. Um, when Obamacare was passed in 2010 and Christmas Eve in the dead of night by the Democrats, I remember turning to my wife and saying, they're going to socialize the insurance products market. This thing is going to blow up. We are not going to be able to afford this, and we're not keeping our doctors. And in 2014, when it went into effect, that's precisely what happened. So my first question to you is: we're literally within 3 weeks of this of being passed, we saw our premiums go from about $800 a month to $2,000 a month, and our maximum out-of-pocket deductible, the back end stuff, go from pretty reasonable for like $3,500 for the family that we had. It was almost like $17,000, and this was literally overnight.
So your premiums
And
went up by a factor of 2 or 3,
right,
and your out-of-pocket exposure went up by a factor of 6.
right, and then the other thing is we lost all of our doctors. So everybody we had at the time, this was before cancer, but all of our other kids and myself, my wife, every doctor we had, we were out, and they wouldn't take the policy that we were able to buy. So from your this was not true before the ACA went into effect. Why does this happen so quickly? And then why does it never get better? So in a marketplace, when new stuff comes in, think of like the iPhone. When it first comes in, it's really expensive. Almost nobody owns one of these things. But over time, markets get cheaper and better for everybody. They expand. But here, it just keeps getting more expensive. The government has to step in again and again to fix a system that clearly isn't working. Why is it? What happened?
So the thing to understand here is that, Obamacare is basically one core, provision, and then lots of ancillary provisions to try to fix the problem that that one core provision creates. Almost like all the king's horses and all the king's men trying to put Humpty Dumpty back together again. So that core provision is what's responsible for both your premiums going up and your access to doctors going down. That core provision is what health economists call community rating, but it's really just a bunch of government price controls. And what those price controls do is they say to an insurance company that if you've got two people of the same age buying the same policy, you have to charge them the same premium, even if one of them has very high medical expenses and the other has very low medical expenses. If one of them is very sick and the other is very healthy, doesn't matter. You have to charge healthy and sick people of a given age the same premium for the same plan. This is Obamacare's centerpiece. This is how people call these Obamacare's pre-existing conditions protections. I should put the word protections in quotation fingers, because uh, what they do is they try to get health insurance, and they do get health insurance to sicker people, people who could not afford the premiums, or people whom an insurance company would not even write a policy because they have already suffered a loss, a health loss, and they are uninsurable. Like if you cause an automobile accident, you can't buy insurance then because it's not a risk that you're asking the insurance company to insure. It's a loss that has already happened. And that's not what insurance is. Insurance is the pooling of like risk. Uh, and so those folks could not get health insurance before. Obamacare said, we're require insurance companies to cover you. We're going to tell the insurance companies they can't charge you a premium higher than they charge anyone else. Why do I call these price controls? Because in a market, what the insurance companies would do is they charge the healthy people the lower premium and the sick people the higher premium, but Obamacare compresses those premiums. So the insurance companies have to charge healthy and sick people the same. So that's the first thing that happened. And so that brings down premiums for the sick, but it brings up premiums for the healthy. And that's the first thing that happened to your family. Your premiums doubled or tripled. And that is the experience of most of the people who enroll in Obamacare. Most of the people who had coverage in the individual market before Obamacare, like you did, most of them were healthy, and Obamacare dramatically increased their premiums. And those are really hidden taxes that Obamacare created in order to try to deliver hidden subsidies to the sick in the form of their premiums coming down. And that did happen. That did happen. Their premiums came down, and a lot of sick people were able to get health insurance who were previously unable to get it. I think it's worth noting here that one of Obamacare's architects, an economist at MIT, his name is Jonathan Gruber, he said that the whole reason they delivered those subsidies and imposed the taxes to deliver that finance those subsidies with these price controls, through these community rating price controls, at hiding the higher taxes in the form of higher premiums and hiding the subsidies in the form of lower premiums, is because if they made it explicit, it never would have passed. So they hid all the taxes and subsidies in order to minimize the opposition to the law by deceiving the public about what was actually happening. And that enabled it to get passed. And as you say, the first thing that your family noticed was your premiums went up. But that's not the only thing that those price controls do. And it's not the only thing those price controls do to your family and to everyone else in Obamacare. It sounds great when the premiums come down for the sicker people because they're able to afford coverage. But the way that Obamacare brings down premiums for the sick is the way that rent control brings down rents for people. It's just a price cap. It's just a price ceiling. And what economists will tell us over and over again, in the case of rent control and health insurance and everywhere else, is when you have a binding price ceiling, quality gets worse. That's why rent-controlled apartments are not very nice apartments, because to the extent those rent controls reduce the price that the landlords can charge, they reduce the landlord's ability and incentive to invest in maintaining that property. A price cap might limit the price that someone could charge, but it doesn't limit the underlying economic reality, which is a quality apartment costs this much, and so the quality erodes. That has happened with health insurance as well under Obamacare. It happened with your plan. When you say that your out-of-pocket exposure increased by a factor of 6, so that you had less coverage, that's a reduction in the quality of coverage. It's a reduction in the quality of coverage because you don't have health insurance for as many medical expenses as you did before.
And
And
the other damage was what the policy experts, maybe you included, call narrowing of networks, which I don't like.
oh yeah, oh yeah,
My term for this is, we're basically medical serfs under Obamacare. I mean, we can only go by law to the medical providers within a very short driving distance of my home. Whereas before, as I said, I could go to Hopkins. I even took a daughter of mine to Mayo Clinic, which is in Minnesota, across the country, and it worked. So I have these huge prices, and then I can't go anywhere. And I'm assuming that's tied into the same. I mean, this is by design. They want to limit your choice to make this policy work for everybody. I mean, or how does it work?
Just like your new Obamacare health plan covered fewer of your expenses than your old Obamacare plan, it also covered fewer of your doctors and the hospitals that you might want to see. And that is a result of those community rating price controls. And here's why. If it costs 61 cents to bring a quality apple to market, and the government says you can only charge 5 cents for an apple, you're not going to get a great big red, juicy, delicious apple. You're going to get a much smaller apple with spots, maybe wormholes, because you, uh, if it costs 61 cents to bring that high quality apple to market, and the grocery stores do that, they're going to be out 56 cents on every apple they sell. They're going to take a 56-cent loss on every apple they sell. And so they're not going to do that. They're going to deliver you 5-cent apples. And if you tell the insurance companies that you cannot charge a price that corresponds with the cost, or the government says we're not going to pay you, let you collect a price that corresponds with that cost, then you're not going to get a $61,000 coverage. I picked that number because there was a study by a Biden economic advisor that looked at this dynamic in Obamacare. They said that MS patients file about $61,000 in claims, but the premiums that they pay are around $5,000. So if you think about this from the perspective of an insurance company, if you offer the best coverage to MS patients, then you are going to pay $61,000 in claims for every one of those. You're going to attract all of the MS patients. They're all going to scrutinize the plan options and find the one that offers the best coverage for their illness. You're going to enroll all of the MS patients, and they're going to cost you $61,000. But if you're only you're only collecting $5,000 in premiums from them, every one of them is going to be a $56,000 loss for you. So even if you're collecting lots of excess premiums from all the healthy people you're enrolling and who are paying now more than they were before, there's still a huge incentive for you to make your MS coverage worse so that those $56,000 liabilities enroll in someone else's plan. And how do they do that? Well, this Biden advisor said they make the drug coverage worse. They make the drug coverage worse by requiring more step therapy for the drugs that the MS patients need, by requiring more prior authorization for the drugs that they need, by using co-insurance rather than co-payments, where you pay a percentage of the drug's price rather than a flat co-payment amount. That adds uncertainty. The MS patients don't like that. They want to avoid the plans that do that. Insurance companies begin competing to avoid the sick in a way that they didn't before, precisely because of these price controls. And that is what happened to you. They began to compete to avoid you by saying, you know what? Sick people like lots of coverage. They hate cost sharing. So we're going to ramp up the cost sharing so that the sick people stay away from our plans. They began saying that they said, you know what sick people like? They like access to lots and lots of doctors, like and hospitals, like Johns Hopkins University. We're going to exclude them from our plans because we don't want to provide coverage to the sick, or we don't want to provide the best coverage to the sick. And if you look at what happened with the networks, the provider networks that were available in the individual market before and after Obamacare, you see that they all shrank. Enrollees in individual market plans had much less choice of doctor and hospitals after Obamacare than they did before. And it's a result of this rent control for health insurance problem that Obamacare introduces. And that is what happened to you and your daughter.
Yeah, and again, I'm
The
really impressed.
insurance companies were
Yeah,
literally
yeah,
competing to avoid you.
yeah, it's a race to the bottom. Just yeah, exactly. And I was impressed again by how fast it happened. Like most marketplaces, when a real marketplace goes sour, it takes time. Like there's this problems, people don't buy the stuff, people retreat. In a marketplace, people then can step in and fix that. But this is a closed, so it's not an open market; it's a closed market. Nobody can get in, and this is what happened and then overnight. And then for me, just getting back to my daughter was diagnosed. So Obamacare goes into effect in 2014. My daughter's diagnosed with cancer in 2015, and then we had all these problems, and then of course the expense just went through the ceiling as soon as Colette was diagnosed with with cancer. I mean, it got totally crazy, and we maxed out every year for the better part of a decade, which was bad enough. And then twice in the 3-year period, even within our narrow network, we were denied coverage. So there's one hospital that has a pediatric cancer ward in Northern Virginia, where you and I both live. And there's one cancer clinic. There are no others to go to. We could only go to those by law. And in 2018, the policy that was available to us in that year, there's only one, didn't cover the hospital. And then fast forward to 2020, with pandemic sweeping the country, we got a notice that the clinic had said it was no longer going to accept our insurance that we had for that year. And so our narrow networks just became literally non-existent. Like they weren't there for us. And it wasn't for a broken bone or like a cold. I mean, this is like childhood cancer. You'd think if you're going to build a healthcare plan, even if you're going to do it like from the top down, like the government decided to do here, you would take care of those people first.
That's what you need the insurance for. You don't
Right.
really need it for a broken bone.
Exactly.
You need
Exactly
it for
right.
a long-term expensive illness like cancer.
Right.
And that's exactly what Obamacare punishes insurance companies for doing, is
Right.
providing quality coverage for long-term expensive illnesses like that.
Yeah, and in both cases, I had to fix this problem for my family. I went into overgear, overtime, just went crazy because I had this real problem that I couldn't get out of. The government was providing me one option, and then it took it away from me. So in 2017, I got the Washington Post to cover our story, got lawyers involved, ended up talking to the one plan that we were going to be able to get for 2018 that wasn't going to give us the coverage of Cigna, and also called Mark Warner's office, our senator, and the combination of public embarrassment that I instituted, and then some pressure through that on the insurance giants from the senator, they did come back in for 2018. That was too late for us because, as you know, Obamacare is sold in such a way that we have to make a choice in 2017 for the 2018. We didn't fix this in time, so I ended up having to shut down part of my consulting firm at the time, lose part of my American dream and go work for somebody else, a friend of ours who had a company that I could, get insurance for that year. And then in 2020, same problem. I called up Senator Warner's office. I said, "We're here again. You've done, now it's the clinic that won't treat my daughter, not the hospital." And in both cases,
they'll treat your daughter. They won't take your Obamacare.
Right. I mean, I could. Yeah, this is so expensive. You could never do it. I mean, we just bankrupt you overnight. So anyway, we got the senator in that case too to kind of the staff to call that off. In that case, it was Anthem, and in both cases they came back in, but reluctantly and under pressure. So my takeaway from that is this is just the problem. The problem you guys identified getting much worse over time for really sick people. And it's not a marketplace. I mean, no marketplace functions in such a way that you have to have the political class step in on an ad hoc basis to provide a service. This is not a marketplace, and despite its name. Anyway, any comments on that? I mean, am I right that this is just a further problem with this system?
We should have insurance companies competing to offer the highest quality coverage for the sick. And they do that in other insurance markets. They don't just compete on the basis of lower premiums, like the Little Lizard says you can save up to 15% on your car insurance. They also compete on the basis of quality, that when you hear the jingle, "Like a good neighbor, State Farm is there," they're saying we provide the coverage that we promised to provide. We provide quality protection from huge financial losses. When you hear the folks at Liberty Mutual saying you can tailor your plan to your needs, that's a quality claim. When you hear them talk about accident forgiveness, have you heard about this in auto insurance? The equivalent exists in health insurance. It was available before Obamacare banned it. It's called a renewal guarantee that says if you get cancer, you can keep paying healthy person premiums.
Let's stop right
Insurance
there.
companies they compete on the basis of quality when we let them.
Yes.
Obamacare doesn't let them.
Okay, this is a really important point, and I
It
want
punishes them for that.
No, it's a great report. Let's talk about what insurance companies are and what is actuarially based insurance. So first of all, recently I know you've been out there saying it was a great piece you sent it to me, and I read it. I thought it was great. Is that we beat up on insurance companies because they're kind of forced to be collusive with the government in this awful plan. But actually, insurance companies are cool, are a great thing. I think, tell me if I'm wrong, but your take on, which I think is great. Well, why don't you tell us what it is? I mean, why are insurance companies the good guys here? Like, what happens in an insurance company that happens nowhere else?
An insurance company is an amazing and wonderful innovation because it gets complete strangers who may never, who will never meet each other, who wouldn't like each other if they did meet each other. They speak different languages, practice different religions, but insurance company gets them all to come together on a voluntary basis and pay each other's medical
Yeah,
bills.
it's incredible.
Pay the medical bills of strangers who are at the worst, most vulnerable moments in their lives. Strangers who they might not like, who they might hate if they met in person. And insurance gets these people to help each other on a voluntary basis. And
And it happens
and
automatically. It just kind of
and it
happens.
and a lot of people will say, well, let's not get too excited about insurance because really the insurance company is only in it for the money, and the enrollees are only in it for themselves too. They just want someone to pay their medical bills. They're not trying to help these strangers. They're just looking out for number one. But that makes insurance companies all the more amazing because they harness self-interest to produce an unquestionably compassionate result, which is helping people out in their most vulnerable moments.
Right, and
And
just to say, compared to what we've just been through with this enormous controversy over continuing government subsidies for this failing program, that is highly contentious. It mostly never works out. It's absorbs all kinds of public headspace that could be devoted to other things. Markets work silently, and they deliver very efficiently, and we used to have a version of that before the ACA.
and a lot of people will say, well, then wouldn't more insurance be better? Shouldn't we have the government compel people to enroll in insurance? I mean, Medicare does what you're talking about, doesn't it? No, it doesn't. Medicare is Medicare and Obamacare. These are compulsory forms of health insurance where the insurance respond not to what the consumers want, consumers who are purchasing insurance on a voluntary basis, but to what the politicians want and therefore what the special interests want. And that is why Medicare is junk coverage and Obamacare is junk coverage that prop up an overly expensive and low quality healthcare sector. The Medicare program rewards all sorts of low quality care in a way that a voluntary insurance market would not. Obamacare creates the race to the bottom in health insurance that we've been talking about. And all of these things happen because it's not voluntary, because you are replacing market incentives where the insurance company has to give the consumer what the consumer wants, or else they're not going to get paid, with political incentives where the insurance companies can keep offering and healthcare providers can keep offering high cost, low quality products and stay in business whereas in a marketplace, they would have been driven out of business.
Yeah, no, this is great, and let's talk about actuarial science for a moment. So one of the things that you told me when I first got to know you, when we were having our problem, we were discussing the Obamacare and all these things. You said, look, under the pre-ACA plan that you had, which was a version of an open market plan in medical insurance products, um, there was enough actuarial science, kind of at play there, risk assessment. This is a very developed science, and people know. I mean, this has been around a while. We know how to assess risk really well, and we just get better at it if we're allowed to. Under that kind of plan you had, your daughter could have diagnosed with cancer, but as long as you paid your premiums, like she was insurable for the rest of her life. In other words, there's something about this grasp on the real that we call actuarial science that allows us to assess risk. In other words, most people are not sick most of the time. So there's plenty of money being collected for those who on the margins end up getting sick. And we know how to, and as long as we have those risk pools big enough, which is part of the problem, I think, in the pre-ACA world, they weren't big enough. They weren't allowed to be big enough. The actuarial science boys can figure out how to keep everybody with a plan that they can continue with, even if they do get really sick, and make it affordable. And then so address that from, I think I'm right on that. Address that. And then also, you also let me know that before Obamacare got shut down, there were these kind of interesting products, these riders that were being offered by different. I think United had one which was if you added this to your existing plan until you lost your job, which is where the pre-existing conditions problem really get started. You could kind of cover yourself until you got into another plan. In other words, the market will provide solutions to problems if you let it. But what the problem is the government gets in the middle of this and makes it really hard, even under the pre-ACA world, although it was better, it was still kind of messed with. But if you let the insurance guys do their jobs, we actually get really good health care. What do you think?
So what this brings to mind is you and I were talking, I think just yesterday, about your experience in post-Soviet bloc countries after the Berlin Wall fell, and our conversation here brought to mind one of the products of those Soviet bloc countries, an automobile that the East German government manufactured. They called it the Trabant. I don't know if you've ever heard of the Trabi, but it is this absolute piece of junk car. I think Time Magazine said "Ich bin junk" to describe this. They said that the rear windshield defroster was there mostly to keep your hands warm while you were pushing this car. It was such junk that it was a two-stroke engine. So you would put the gas and the oil in this tank at the same time, and then you have to shake the car back and forth to mix the oil and the gas together. And we laugh at this because it's ridiculous, but we recognize it as ridiculous because we have much better options. That was the best that the East German socialist government could come up with, the best kind of car they could come up with. And we, who had the benefit of a competitive market in automobiles and much more innovations, much higher quality products, we're able to look at those primitives over there in East Germany and laugh at them because we have access to something better. But in healthcare, we're all sort of driving a Trabant right now. And we don't know that we could have it better because we don't have that that competitive market system that shows us how much better it could be. But we do see glimpses of it in places. We saw glimpses of it in the pre-Obamacare individual market for health insurance, where they did offer this innovation that meant that if you got cancer, you could keep paying healthy person premiums and stay insured for the rest of your life. Keeping that cancer diagnosis not an insured condition, rather than letting it become a pre-existing condition, an uninsurable pre-existing condition, because that's what pre-existing conditions are. Instead of letting people, but that was, as you say, that was a very small part of the market. The individual market is about 10% of the private health insurance market in the United States. The other 90% is employer-sponsored insurance. Why is that? Because the government penalizes us unless we enroll in employer-sponsored insurance. It penalizes you if you choose one of the higher quality plans that covers you for the rest of your life. If you enroll in an employer plan, well, people, by the time they get to be my age, change jobs about a dozen times. And if you enroll in one of these employer plans to avoid the government's penalties, and then you get cancer and you lose your job, either because your employer, the plant closes, or you get fired, or you get so sick that you can't work anymore, or you divorce, or your spouse dies, or you turn 18 or 26 or whatever. If you lose your connection to that employer plan, then all of a sudden, what your medical condition, which could have and should have been an insured condition for the rest of your life, because the government forced you into a short-term employer plan and then threw you out of it, now your medical condition is an uninsured and uninsurable pre-existing condition. So the problem that Obamacare was trying to create with these price controls that are making the quality of coverage worse and made the quality of your coverage worse, Obamacare exists to create a problem that the government started, a problem the government caused, which is or exacerbated at least, the problem of pre-existing conditions. And there's one more innovation that you mentioned, you touched on it, where the market was even trying to fix the problems of the Trabant, where the market said, that innovation that we mentioned that said you can keep paying healthy person premiums even after you get a cancer diagnosis, that's actually a separate kind of insurance that comes along with your basic health insurance plan. They call it a renewal guarantee. It doesn't insure you against the risk that you're going to need medical expenses this year. It insures you against the risk that you're going to get an expensive long-term condition that will increase your premiums, that will increase an actuarially fair premium for you for the rest of your life. That's a separate type of insurance, the insurance against the risk of higher premiums. And an enterprising insurance company, United Healthcare, realized that. They said, wait, this is a separate product, really. We could break that off. We could offer it to people in employer-sponsored insurance so that if they get cancer while working for this employer and then suffer a separation from an employer for any of the reasons we mentioned, they could enroll in one of our individual market plans at healthy person premiums. they began to market this. This protection cost about 1/5 of the cost of an individual market plan. It, but it protected you against having to pay cancer patient premiums or against having an uninsurable pre-existing condition. They got it approved for sale in 25 states in 2008 and 2009. And then what happened in 2010? Obamacare effectively made it illegal for them to offer this innovation. So instead of me and my employer plan being able to buy one of those products, I am now stuck in my employer plan, and you're in the individual market where Obamacare is making the coverage worse.
The open market, if it's allowed to function, will provide solutions to problems like this. And we had evidence of that in Obamacare to kill it. It just killed it right then. Yeah, that's incredible. And just to say, it's a longer discussion we can't have now, but just to your point, I mean, the idea that government involvement in the employer healthcare. I mean, they created this during World War II as an incentive because we couldn't apparently attract workers in World War II with salary, so they did benefits anyway. But this is a long-term government involvement in the provision of medical insurance to the populace of the United States, which over 50, 60, 70, 80 years has just gotten worse. And Obamacare is just more of the same to fix the same problem, and it's not working. Like, it's just not working. It's collapsing on its own, and we need a way out. What I call the matrix. I mean, I'm stuck, people are stuck in a matrix, and they need a way out. And so let's turn now to your idea on how to do that. Because I really like sort of what you've done here. It's a very clever thing. I'll just give you this is the title. You've given your own paper. It's Obamacare if you want it, but choice if you don't. And what I like about this is that I have a dual problem here. I want to get healthcare for me and my family, the ones who have not been sick, sort of back to that original sort of healthy, robust insurance product. I have a sick daughter though, who's doing fine. I mean, she's sort of past this remission stage, but because as you told me all those years ago, because she got sick under this non-insurance regime, she's kind of had that car accident. She's not insurable anymore. So I'm going to need some form of, as are all Obamacare victims who've gotten sick under Obamacare, we're going to need some form of government plan to make sure that she's okay. So you actually provide an answer to that question as a dad that I have, but you also have these very innovative ways of getting everybody out who can get out, actually have a way out. Why don't you tell us sort of how you came up with this and what the details are?
Sure. So to round out the previous discussion before we move on to what to do, the tax penalty that exists if you want to buy insurance that covers you for the rest of your life, that penalty predates World War II. It's been around since the 1920s. It's been around almost as long as the income tax has. And so it's really been 100 years now the government has been penalizing you if you buy higher quality health insurance. And all this talk about, communists and socialists and health insurance quality brought to mind something that Winston Churchill said. And I can hear now supporters of Obamacare thinking to themselves, okay, but there will still be some people who won't be able to get health insurance if you leave the market to its own devices and let it innovate and that sort of thing. And that's true. That is true. There are people who will fall through the cracks in a market system. We'll get to that in a moment. But Obamacare is not the solution to that, because this is where Winston Churchill comes in. He said that socialism is that capitalism is the unequal distribution of wealth, and socialism is the equal distribution of poverty. That's really what Obamacare has done to healthcare quality. If you in an open market for health insurance, you will have an unequal distribution of access to resources to help people afford the medical care that they need. Some people will fall through the cracks. It will be unequal. But when you replace that world with a world of Obamacare, what you will get is an equal distribution of low quality health insurance. And instead of some people suffering, everyone will suffer. And I think that your story is the proof of that. Now, what do we do about that, particularly starting from where we're starting right now? I think what we want to do is we want to expand access to medical care. We want to make medical care as universal as possible. And the way to do that is not to force everyone into Obamacare, because you're proof that Obamacare does not make health care universal. Obamacare is the reason that your that your insurance company was denying coverage for the services that your daughter needed. So rather than and as such, what Obamacare was doing was it was causing the cracks in our health sector to widen. And you and your family fell into one of those cracks. What we need to do is we need to seal up those cracks so that fewer people fall through. And the way to do that is to let people buy plans that are not subject to Obamacare's rules. President Trump did this in 2018. There's actually Congress uh, created a form of health insurance, or designated that a form of health insurance would not be subject to Obamacare's rules. They called it short-term limited duration insurance. But what President Trump did in his first term is he said, wait a second, this exemption from Obamacare is actually broader than most people think. We can allow people to buy long-term Obamacare exempt plans through this market. So that's what he did. And 2 federal courts said, yeah, federal law has enough flexibility that insurance companies can offer long-term Obamacare exempt plans. So he did that in 2018. The insurance companies started offering plans, comprehensive coverage, according to nonpartisan observers like the Congressional Budget Office, at premiums 60% below the lowest price Obamacare premiums. And these are plans that did not have the incentives that Obamacare has to ration care and cause the cracks to widen. In fact, these plans had lower cost sharing than Obamacare plans often, and broader choice of doctors and hospitals. So those are 2 of the quality problems that Obamacare created that this market was already solving. And so what I propose in that paper that you mentioned is, hey, make that permanent. We should mention that was in place for 6 years. The Trump rule was, and then President Biden rescinded it. So what Congress needs to do now is make that rule permanent. Say, don't touch Obamacare. They can do this without touching Obamacare. Leave Obamacare as it is, but let people who don't want Obamacare, so the Obamacare will be there for people who want it, but let people who don't want Obamacare, people who want to save 60% on their health insurance premiums, let them buy one of these plans. An Obamacare exempt long-term health insurance plan. And if you do that, what the evidence suggests is it's not going to lead to the sort of adverse selection death spiral that people predict Obamacare will suffer. We had an experiment, a nationwide experiment in giving people access to Obamacare exempt plans. The Trump rule was in place for 6 years, and Obamacare enrollment did not drop. You did not get an exodus of people from Obamacare. Obamacare enrollment almost doubled over that 6-year period. And Obamacare premiums didn't spike, which is what the critics predicted would happen. In fact, Obamacare premiums finally remained flat for about 6 years. They were spiking before the Trump rule, but then they were flat for 6 years. And they didn't spike again until Biden rescinded that rule. So we can have choice for people who want it, or Obamacare for people who want it, and choice for people who don't, through that change, and making permanent, universal and permanent, a type of Obamacare relief that President Obama provided as well.
Yeah, well, but before you go there, let me just ask. So, on the Trump short-term idea, this we need to make it legislative. It has to be codified in legislation, because right now it's executive order and can be rescinded. Right? Your client, you want the Congress with Donald Trump behind
Well,
it.
right now it's not in place at all.
Okay, but to bring it back and then make it legislatively permanent, so that this just doesn't have this volatility. People can start planning their family lives around having had this. It's called short term, but it's actually renewable. I mean, like it extends. You can keep going with this thing.
Yeah, the statute says, federal law says, the type of insurance that's exempt from Obamacare is, quote, short-term limited duration insurance. But because Congress doesn't really understand insurance, and Obamacare supporters don't really understand insurance,
Right.
they don't understand that exemption is actually big enough for insurance companies to offer long-term health insurance to people. And the reason is that those renewal guarantees that we talked about that let the cancer patients pay healthy person premiums, it's a separate insurance product. Congress has no authority to, or the federal government has no authority to regulate that insurance product. So multiple federal courts and the Trump administration acknowledged that, and multiple federal courts said, yeah, that's a valid interpretation of federal law. So though that market that we call short term can actually offer long term. health insurance.
Yeah, and I'm assuming I'm right here when I say that if that gets codified into law, as you asked, and we've got this kind of newly robust version of healthcare available that's outside of Obamacare, more people are flooding in. There's just going to be a financial incentive for those who provide this product to even innovate within that. I mean, could you just get better and better and better over time as they understand what the needs are of those who have it? Am I right on? I'm assuming I'm right on that.
I wouldn't say
It would
yes.
function that way. Yeah. There's another part of this which I think is really interesting. There was a version of an exemption, if I'm using the right term, that
Sure.
President Obama himself allowed. Tell us about that one it's in your paper.
Yeah. So the Obamacare imposed these rules, including the community rating price controls that I mentioned, and a bunch of other regulations, all trying to prevent from happening to you what happened to you. But those regulations are working. All the king's horses and all the king's men are not putting Humpty Dumpty back together again. And folks in the territories, the U.S. territories, American Samoa, Guam, the Northern Mariana Islands, U.S. Virgin Islands, Puerto Rico, they said, whoa, if you apply these rules to our insurance markets, it will destroy our insurance markets. Please, please, please do not apply those rules here. And unlike people in the 50 states, the territories got an exemption from the Obama administration. President Obama said, no, it's fine. You don't have to abide by any of the 6 most expensive regulations in Obamacare. The guaranteed issue and community rating. Those are the pre-existing conditions provisions, or the community rating price controls. Essential health benefits, single risk pool, medical loss ratio requirements, rate review. None of these apply in the territories, and they haven't since 2014. So folks in the U.S. territories, U.S. citizens in the U.S. or any resident of U.S. territories have more freedom to choose their health plan than you and I do. And they did this. The reason the president did this is because he acknowledged that this would have destroyed access to health insurance and health care in territories. It would have been a much quicker version of what happened to you. And so herein lies a hopefully bipartisan way to provide people relief
So
from
before you go on,
Obamacare.
let me just understand. So you're saying that since this law was passed, went into effect in 2014 till today, if you're in these territories, there are insurance companies competing for your business to provide really great insurance products to you and your family, exempt from Obamacare? And
Well,
it's just like,
it took a while for them to come back. Some states or some territories do have Obamacare-like regulations, like Puerto Rico's got some rating restrictions that I think they shouldn't have because it's making insurance there worse. But in the U.S. Virgin Islands, there's almost none of the Obamacare-like health insurance regulations. It did take the insurance companies a while to come back into the U.S. Virgin Islands, but now they are selling these sorts of policies. And I mentioned herein lies another way to give people relief from Obamacare, give them access to low-cost, high-quality health insurance. Just say, all right, what President Obama did in the territories by executive fiat, exempting them from Obamacare, Congress should say, we're going to codify that. We're going to make it permanent. By writing that into federal law, this doesn't apply. These regulations don't apply in U.S. territories. Congress should then make that exemption, that permanent exemption, universal, by telling the states that they cannot prohibit their residents from buying a health insurance plan that is legal for sale in a U.S. territory. Right now, every state says that if you want to sell health insurance to one of our residents, you have to comply with all of our state's regulations, which means that you can't buy insurance from any other state or any U.S. territory because those plans don't comply with Virginia's or Kentucky's regulations. But if Virginia or Kentucky just says, look, we'll accept any plan that any U.S. territory licenses, then the residents of Virginia or the residents of Kentucky have access to those plans, and the market for plans that U.S. territories approve explodes because just about every state has a much larger market than the territories do. And you'll be able to give people access to lower cost, higher quality, long-term health insurance that can keep people out of Obamacare when they get sick and therefore bring down Obamacare premiums.
and if I had one of these plans when my daughter got sick, she would today have that kind of durable access to insurance.
She'd probably be going to Johns Hopkins
Yeah.
rather than trying
Incredible.
to chase providers
Well,
around Virginia.
I was on that panel when I testified in front of the Senate with some people from the Midwest. They were farmers, and they had a terrible time, and they kind of favored Obamacare, but they kind of recognized it was not great in every case. So if you're living in Iowa and you don't like Obamacare, and this gets passed as you have recommended, you could buy a plan in the Virgin Islands and
That's
just
right.
have access to medical care through a real insurance product that is that's durable and affordable. I mean, the
I mentioned that
affordability
you're
here.
unusual, that you're
Yeah.
weird because you actually did something about this,
Right.
but it's happening to lots and lots of other people. It's happening to cancer patients in Texas, Obamacare enrollees in Texas. Not a single Obamacare plan
Yes.
covers MD Anderson Cancer Center.
I know.
But in the short-term market, there
Yes.
are insurance companies that cover MD Anderson. And if insurance companies or if the state of Texas freed their residents to buy Obamacare exempt plans from U.S. territories or from insurers that kind of approved in U.S. territories, then the market for affordable health insurance products that cover MD Anderson would
Yes.
expand, and fewer people would fall into the crack in our healthcare system that you and your family did.
I have an MD Anderson story. So when we were dealing with this horrible problem in Virginia, we said, well, what if we moved to Texas? No state income tax. That's a great benefit. But also, they have a lot of cancer hospitals that deal with children, a lot more than they're in Northern Virginia. And actually, so we called Humana, and Humana said, we have a plan, right? And I said, great. So I bought a ticket. My daughter and I went out there to look for houses. We were going to move our, I was self-employed at the time, so I could go there. I flew out there. That was on I was on a Thursday. We got on a plane. I got back on Sunday, called Humana that Monday. This was in probably 2018, if I remember correctly. And they said, oh, sorry, that plan's no longer available. It was available last week. We just canceled it. So there's literally not a single plan to this day that you can
Wait a
buy.
second.
Yeah.
Wait a second. Did
Yeah.
Humana tell you that they had an Obamacare plan that covered MD Anderson?
No, MD Anderson and Texas Children's Hospital, and this was on a Thursday. I forget which. It was in the spring of 2018, I believe. And so we flew out there, and then we got back that week. And that Monday morning, I said, "Okay, I want to buy this plan. I want to do this."
What
And they said, "Oh, sorry,
year
we
was
canceled it over
this?
the weekend. We canceled it."
What year was this?
I'd have to look back. I think it's 2018, maybe 2019. I can't remember.
Because the insurance companies are really sophisticated about this. One of the Biden economic advisor, who's actually at the University of Texas, Austin, and he and his co-authors, when they did that study that I mentioned, when I was talking about MS patients, they said the insurance companies are so sophisticated in the way they compete to avoid sick patients. They will charge high cost sharing for generic drugs that MS patients and other patients need. Not because the drugs are expensive, they're generics, but because the high cost sharing deters the expensive patients.
There you go.
It would not surprise me if Humana gets a call from Christopher Briggs asking about this policy, and looked up Christopher Briggs, found out he's got a daughter with cancer, and then
Yeah.
canceled the plan over the weekend
Wow.
just to avoid
Yeah.
Christopher Briggs and his family.
Yeah.
It might not have happened, but it would not
Right.
surprise me if it did happen.
Yeah. And so we lost our mind. We couldn't believe I just spent $3,000 for looking at
Yeah.
getting back and forth. And so we ended up calling Senator Ted Cruz's office. I said, my wife did, and she said, do you realize that there isn't a single Obamacare plan it's for sale in Texas that covers a children's hospital visit or an MD Anderson visit for a daughter dying of cancer? And they said, no, it's not true. And then they went and looked, and they came back and said, actually, it is true. We had no idea. And that's true to this day. It's kind of incredible. It's incredible. Yeah. President Trump, tweeted out mentioned that Michael Cannon's got a really innovative thing. It was kind of a big deal. Subsequent to that, he came out with his own plan of a sort. And there's some good things that we talk about. There's some good things in there. Why don't you tell us what the good things are that President Trump has suggested that Congress follow? And then how do we make it better using your ideas?
So the best thing in his great healthcare plan, which was not really transformative or dramatic or fundamental reform, but there was at least one good thing in there, which was he wants to eliminate unnecessary government regulation when it comes to that reduces access to medicines And the specific regulation that we're talking about here is unnecessary prescription requirements. What determines whether a drug is prescription only or over the counter is the federal government. The U.S. Food and Drug Administration says we're going to require every patient who wants to access this drug to get a prescription, and it has to come from a licensed healthcare professional, and then the states decide who it gets to be. In some cases, it's nurse practitioners or a pharmacist, but mostly we're talking doctors. Doctors' appointments are expensive. They are time consuming. And so that adds to the cost of getting a medication. And when a drug is prescription only, insurance tends to cover it. And when insurance tends to cover it, that makes the price more expensive. So it also ends up driving up the price of medicines. And there are lots of examples of the FDA requiring these prescriptions when they're just not necessary. I mean, the birth control pill has been on the market for 60 years. Women know how to use it. If they don't, you can educate them very quickly, and they're more conservative. They're more risk averse than the doctors who are giving them recommendations about. So you could say that they would be even more safe if instead of encouraging them to rely on doctors, you encourage them to make their own decisions. There have been situations where the FDA required prescriptions for non-sedating antihistamines like Claritin, but allowed people to get Benadryl over the counter, and that led to airplane crashes and car crashes and fatalities. So here you have regulation actually making people less safe. What the Trump administration said they want to do is they want to move more drugs to over the counter, which will reduce reduce prices, reduce unnecessary barriers to care. I think that's all to the good. What the Trump great healthcare plan is missing is the idea that we've been talking about, and the one that President Trump posted about. He attributed that quote to me on Truth Social. It is the idea of making universal and permanent both the Obamacare relief that he offered people from 2018 to 2024 and the type of Obamacare relief that Obama himself has offered to U.S. territories from 2014 until today. And I've heard stories about why he didn't include that, and I think it's basically because his team worries about charges that these plans are junk insurance or they won't cover people with pre-existing conditions. But as we've discussed, Obamacare can still be there. There's no reason not to give people this exemption from Obamacare if Obamacare will still be there for people who need it.
Let me ask you this on this. We talked about this, privately a couple days ago. If we end up having this canon plan kind of made permanent, which I hope happens, those who want out can get out. My daughter's left behind. She's just going to have to be that forever. But if the number of persons kind of in Obamacare is smaller and right size for those who actually need this, who've fallen through the cracks or have been injured under Obamacare, as my daughter has, there's a chance then that there could actually be better provision of care. It's smaller numbers of
Right.
people. The government can focus on those who actually need it. I mean, there's some evidence in the states that like the really sick people get pretty decent coverage under the state plans. I'm assuming the federal plan would become the same. I mean, how would that work to the benefit of my daughter?
So as we've discussed before, what we want to do is we want to prevent, we want to
Yeah,
rescue, we want to save people. We want to save the next 2-year-old girl with leukemia from falling through the same crack in our health sector that Colette did. We want to save the next Colette. We want to give the insurance company or insurance companies who cover the next Colette incentives to maintain access to the care that she needs. We don't want to create incentives for them to compete to avoid her, which is what
right.
Obamacare is doing, and causing that crack to exist and to widen. So we want to put in place rules that will save the next Colette. And we also want to do things to help the Colette that we know
Right.
and all the other Colettes out there.
Right.
And there are lots of things that Congress needs to do to make healthcare more affordable for Colette. And one thing that that Congress can do is it can keep Obamacare in place. It won't eliminate the problems that we can't eliminate the problems with Obamacare. It will, as long as Obamacare exists, it'll still have these race to the bottom incentives. And hopefully, though, we can make other reforms that I've been working on here at the Cato Institute for years, and others
Right.
have as well. John Goodman of the Independent
Right.
Institute has been working on for years, that will just make all of our healthcare problems smaller by driving down healthcare prices so that insurance becomes less necessary.
Right.
And so that the perverse incentives in Obamacare are less harmful
Yeah.
than they are today. That requires, a bigger conversation about reforming the tax
Right.
code and the penalty that the tax code imposes on people who want to buy their own health insurance or just control their healthcare dollars. Right now,
Right.
employers control about $1.6 trillion of their workers' earnings every year,
Mhm.
and get to use that money to select and purchase low quality health insurance for their workers. If we let the workers control that $1.6 trillion, we'll get a much higher performing health sector with lower prices and higher quality.
Right.
That's another conversation. I hope we can do another podcast on that.
Yeah.
But for now, what we need to do is we want to stand still bleeding. We want to save the next Colette from falling into the same trap that your Colette has.
Right. And for the people that are worried about the expiration of the Biden's era subsidies and are worried that if the subsidies go away, there's people who are hurting right now, right? But if Congress does, and Donald Trump gets behind this idea that you've proposed, and they actually actually, there's a way out, and they can actually start buying healthcare right away without having to sort of be subject to this political nightmare of trying to convince two parties that don't agree on anything to provide this sort of basic service that can be done without them. I mean, there are people hurting right now, talk to them. I mean, why do they want this? I mean, it's their only hope, I think. I mean, providing more subsidies is just going to lead to providing more subsidies later. This never ends.
So, one reason I keep emphasizing that President Obama himself provided people relief from Obamacare is because we need to convince Democrats that there is another way. We need to get Democrats on board with respecting people's right to make their own health insurance decisions. If the government's going to provide subsidies to people, do it in a way that doesn't interfere with that right, mine and yours and everyone else's, to make their own health insurance decisions. Because right now, all Democrats are talking about is, well, just throw more money at the problem, and anytime they see some deprivation, that's their impulse. They want to throw more money at the problem. We haven't spent much time talking about those temporary Biden Obamacare subsidies. These are subsidies that President Biden put in place basically during the COVID pandemic. To Obamacare already subsidizes families of four making up to $129,000 per year. And those subsidies are still there even after the Biden COVID era subsidies disappeared. But the Biden COVID era subsidies, those were subsidies largely for people making above $129,000 per year. In fact, people earning all the way up to $600,000 per year could qualify for these subsidies. And if your Affordable Care Act is making health insurance so expensive that people, earning $200,000, $300,000, $400,000, $500,000, $600,000 per year need subsidies from the taxpayers to afford it, it's obviously a failure. But more importantly, throwing more money at the problem is not that highlights that throwing more money at the problem is not a solution. That's just making that problem worse. And so the people who need the solution to the excessive premiums that people are paying in Obamacare right now, when people who lost those subsidies are now paying 100% of the Obamacare premium, is to give them access to these lower priced comprehensive plans that are Obamacare exempt. And then we could talk about it, what to do with the people who are still in Obamacare if they can't afford coverage. If they're making $500,000 a year, probably they don't need government subsidies, and they'll be fine. Maybe they can sell a house and use the proceeds to pay for their medical care, and so, but Uh, but we need to break out and get Democrats to break out of this mindset that the only solution that's available to healthcare deprivation is just throwing more government money at it.
Right. Yeah, my last comment will be I just amazed, and I think you sent me a very interesting meme, back a couple weeks ago about, why progressives want to hand power over their healthcare to the government because it really effectively means for them. Like I don't want this to happen to me, but they seem to want this, which effectively says you want Ted Cruz to have a say in the kind of doctors and healthcare that you can get. You give it to the government. There's two parties, and half of the country doesn't like the other half of the country's politicians. So why would progressives be in favor of handing their healthcare to Donald Trump and Ted Cruz? How about we just get it out of their hands and let people buy what they want? I just don't understand it. I mean, I have millennial children, and a lot of their friends are so-called socialists. But then you ask them, well, do you want Ted Cruz and Donald Trump deciding what apps are on your iPhone? And they go, no, we don't want that. I said, well, you're
Right.
you're something, but you're not a socialist. You don't want government involvement. Anyway, just I
I
just
was in a
didn't
debate
understand
one
why they
time, and you can find this online still, I think. I was in a debate one time with Nobel Prize winning economist Paul Krugman. He was also a New York Times columnist. And I made the point, he was railing against Republicans and what they've done with the government healthcare programs and blah, 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 blah. And I made the point, look, if you want the government to control healthcare, if you want the government to tax people, to provide healthcare to people, or regulate healthcare the way that Obamacare does, then Republicans are part of your healthcare plan.
right. By definition.
And Republican control of healthcare is part of your healthcare plan. You might not like them. You might not want them to be in office, but you know they're going to win office. You know they're going to be in control at least some of the time. So unless your healthcare plan also includes a plan for abolishing Republicans, they are part of your health plan. And that should scare them. I mean, right now, they have we have Robert F. Kennedy Jr. as the Secretary of Health and Human Services. I
Yeah.
enjoy asking single payer advocates, do you want a single payer plan that Robert F. Kennedy Jr. is
In charge of.
running? Do you
Yeah.
want, because if you give that power to the federal government every so often, you're going to get an RFK Jr. That's going to be running it. Are you sure that's really what you want?
Yeah. And the answer is no. Obviously, no. Yeah. Michael, this has been great. I have more to talk about, so do you, but I think we've reached our limit at the moment. So we'll definitely have you back, and keep innovating, and let us know how we can help you sort of wave around your plan. And I encourage everyone to go to Cato's website and find your plan, read it. It's really interesting. Congress needs to listen to, and so does the president. And I think good things could happen if they both do. So thanks, Michael.
Thank you for having me. I look forward to more of these conversations, and I would be remiss if I didn't say to you, Chris, that I mean, how much I admire you for your advocacy on this issue, because it's really hard for a lot of people to talk about personal issues like health of your family members, family finances. It's like inviting the world to into personal matters, inviting them to criticize you. It's taking a risk to try to improve healthcare for other people. There are a lot of other people out there suffering what you are, but not many of them coming forward to talk about it in the way that you have. And part of it is because of that risk that you're taking. So I wanted to say thank you for doing that. Thank you for letting me be part of your efforts and advocacy on this.
Well, thank you, Michael. And I would just say, if it weren't for your sort of advice and counsel, I wouldn't have done this. I mean, you really are responsible for my kind of taking this step in many ways. And yeah, we shattered the privacy of my daughter and my family. But, we were in a situation where if we didn't do it, she wouldn't be saved and others would be hurt. So anyway, so thank you for all the
it
counsel.
means a lot to me, because as we've discussed, you've got a 12-year-old daughter, and so do I.
Yeah, right.
While my kids were, healthy 2-year-olds playing, and I say kids because I've also got a 12-year-old son. I've got boy-girl twins the same
Right.
age as Colette.
Right.
And while they were healthy and playing and going through all of these milestones and all of that, Colette was going to this cancer center and that one and having all these things done
Right.
to her and suffering. And this has been personal for me because I know that there before the grace of God. I mean, this could have happened to my kid, and it may still happen to my kid. And I want to fix this before it does happen to my kid. And I don't want my kid to fall through the cracks
Yep.
that Obamacare opened up for you.
That's very well said. Thanks, Michael. Thank you again. Yeah, good.
Thank you.